New York osteopath Dr. Michael Belfiore is under criminal investigation.
Tell me about the back thing. Go across your back, down your back.
A federal agent is playing the role of an injured patient on the prowl for powerful painkillers.
What type of medicine? How much does it
No!
cost?
You're gonna get the whole what's it called.
But based on this undercover footage,
I get you into physical therapy, I can get you real MRIs, real
Okay, cool.
tests,
Belfiore hardly presents himself as a pill-pushing Dr. Feelgood.
real orthopedics. Medication, bull.
Yeah.
The New York osteopath appears so sincere about the responsible use of pharmaceuticals.
Narcotics are illegal to distribute to other people other than yourself.
He wants a larger audience.
I would love to do like a Dr. Phil kind of thing where I just like sit in one chair, you sit in the other chair. Because
Yeah.
I have to show people that medicine is not a one line kind of thing. It's a two-way transaction between people.
But the feds say it's not so much the words but his actions that were lethal and make Belfiore poised for prison. 2 patients died on his watch.
A rogue doctor can do a lot of damage.
Prosecutors say former Marine John Eubanks is Belfiore's first casualty.
He was really the epitome of just fearless. You know, I never seen him scared of anything in my life.
But Eubanks changed when he returned from deployment.
Physically, he seemed to lose his motivation a little bit to really work out as much and to be as fired up. Maybe a little bit more tired and sluggish.
Eubanks began seeing Dr. Belfiore, complaining of back, neck, and spine pain. Belfiore prescribed increasing doses of oxycodone, a highly addictive opioid, as well as anxiety meds and muscle relaxers.
He was coming in for months and months and months with pain that was well under control.
What do you mean by well under control?
He had no problem with the program that we made. He had no problem maintaining it.
2,910 pills over the course of 17 months to John Eubanks.
Well, yes, because that was the program we instilled. And that was a program that was working very, very well with him.
But John Eubanks died of acute mixed drug intoxication, according to his autopsy. Prosecutors claim Belfiore ignored at least 40 red flags that Eubanks may have been abusing the meds, including lab tests that showed the presence of THC and Xanax in his system, neither one prescribed by Belfiore.
Why did you continue to give him the oxycodone if he had tested positive for another anti-anxiety?
I also explained to them, it's unacceptable. It's not something that you shouldn't be doing.
Another red flag, Eubanks may have been sharing or selling his pills.
He said he was out of the medications early and even said he needed new prescriptions because his pills were stolen. Did that raise a red flag?
Things happen. Things happen to patients. I've had patients who said that their dogs ate the medication. And so I says, I don't believe you. And they come in with the chewed bottle.
And on 2 occasions, drug tests showed no sign of the oxycodone prescribed by Belfiore in Eubanks' system.
Did it give you an inclination that maybe he was trying to sell the drugs or sharing them with other people?
This is one of the things that grind my gears, because if a patient doesn't need the medication and doesn't take it, that's a great thing. You know what I'm saying? We're making success in our treatment.
But Eubanks' personal environment seemed ripe for pill sharing. His sister, Kristen, and his girlfriend, Melissa McConnell, both who worked in the medical field, have been criminally charged with forging prescriptions, including oxycodone and Xanax. Belfiore's attorney says that raises a big question. Where was Eubanks getting the drugs that killed him?
You have no control over what a patient is going to do. And you can't read tea leaves and you can't speculate on what patients are going to do after they leave your office.
The government drew a direct connection between Belfiore's practices and Eubanks' death. But his attorney says there's no proof Eubanks didn't die from overdosing on someone else's pills or abusing the ones prescribed.
They don't come in and say, hey, doctor, you know what? You prescribed this medication for me. I'm going to go home and I'm going to drink the whole bottle and I'm going to kill myself.
But prosecutors upped the ante, claiming Eubanks didn't even have a medical need for the drugs Belfiore gave him in the first place. Drug enforcers are putting the spotlight on doctors, claiming many of them are tempted by the lucrative benefits of pill pushing.
When this opiate pill craze started, you saw some greedy doctors who saw people that wanted these pills really badly, and their greed overtook them.
Patients don't walk in here wearing a t-shirt saying, "Hi, I'm an addict." They don't carry cards that say, "I'm an addict." They don't wear buttons that say, "I'm an addict."
Well, one of Belfiore's patients did. Self-admitted alcoholic Edward Martin, an electrician who showed legitimate evidence of nerve injury, but did the prescription fit the pain?
They're saying you gave him 248 pills over the course of 2 visits in a month and a half. Is
Yes.
that a lot?
No, not at all.
But Martin died shortly after receiving his second prescription from Belfiore. The government blames the doctor. The doctor blames the patient.
He was found on his bed with chopped pills, and he had snorted the medication. The instructions on the bottle did not say chop up the pills and snort them.
Martin was found with several pill bottles nearby. Crime Watch Daily discovered that Martin had been getting Oxy from another doctor while seeing Belfiore, and that he had visited a heroin den in the past.
They will do anything and everything to get their hands on drugs and narcotics.
But prosecutors say Belfiore's most egregious act was giving painkillers to an alcoholic.
You knew in the chart that he had a problem with alcohol. Why would you give him oxycodone, which has addictive problems, if you already know he has an addiction problem with another substance?
I chose not to treat the alcohol problem. I chose to refer the alcohol problem to addiction specialists.
2 people overdosed
Correct.
because they incorrectly used the medication.
Correct.
They called you a drug trafficker.
Sure, they can call me whatever they want. Prove it.
Coming up, is Dr. Belfiore addicted to the money?
Did you ever sell your prescription pads for money? Did you ever sell prescriptions for money? Did you ever sell pills for money?
Or is he an honest man on a mission to heal?
Were you running a pill mill out of this office?
All my answer to that is I didn't write pain medications for people who had athlete's foot. I didn't write pain medications for people who were coming here complaining that they didn't like their hair color. I wrote prescriptions for pain for people who were complaining of pain.